Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today I am catching up with the co-founder and CEO of Omada Health, Sean Duffy. Sean, how's it going?
It is going well. Great to be here, Jessica. It's been a minute.
It has been a minute indeed. We were talking about how long it's been since we've chatted. And actually, the last time I talked to you was August of 2020. And we were talking about Teladoc's $18.5 billion acquisition of Livongo and what that deal meant for the future of chronic condition management as it related to digital health and virtual care. Now, I actually, Sean, want to pick up the conversation right where we left off and kind of re-ask that question, particularly now because what that deal meant before and everybody's exuberance about it has kind of changed in the last couple of years, particularly as we've seen in the last year and a half, Teladoc having to take a write-down of literally half of the purchase price of Livongo to kind of bring that value back into alignment, you know? So I'm curious from your perspective, I mean, what do you think this deal now and the fact that it really hasn't manifested into what we thought it was going to when it first happened. What do you think this deal means now for the chronic condition digital health space? I mean, what are your thoughts on that?
Well, it's a good place to start. And, of course, utmost respect to Teladoc and Livongo. It was a very, very important transaction. I think it was a statement of where we were at. What I'll say to you is really the same things that I say internally to our teams. When it feels utterly incredible, it's actually probably not as good as it feels. And when it feels incredibly sour and somber, it's probably not as bad as it seems. So I think this is one of those kind of classical first principles examples of like truth is in the middle. So I feel just as optimistic as ever before, in digital health. I actually think it's centering. I think we probably swung the pendulum a little bit too gloomy now. I think it'll come back and, an impact will continue and buyers still need support from companies like Omada. And, if anything, the epidemiology has gotten even, more petrifying, resulting in needed solutions. So, I think it was just almost an example of an interesting moment in time.
Interesting moment in time. Okay. It's not making the case for chronic condition management via virtual care any more difficult. That's not your experience at all?
It's the signal, the signal that I feel most centered is what our customers are saying. And it's interesting. I mean, I get asked about that transaction all the time, as you might imagine, and it's great to be asked about it. It tends to come from investors or Wall Street or the media. Tends to not come from our customers. I don't think I can count on my hands the number of times and be like, well, does this indicate something negative about the future of care? Because they're looking at their diabetes costs, growing and growing and growing and growing, and they're not feeling satisfied with the pace of innovation in the existing ecosystem. So, thus far we have not seen, anything but continued need at the customer level.
Well, that is actually reassuring to me to hear. And it's like, I have to ask you about it. I mean, like you were Omada was at the time, I felt like just, right there alongside Livongo. And there were a handful of others that really were just bolstered by that deal. And so it's like, it's interesting to me to hear, what's happening now, particularly as that, that deal has just kind of lost its luster. And so I appreciate the fact that none of your clients are really talking about that. That's pretty interesting to me.
Yeah, that's where we always want to place our focus. I mean, it's interesting. The blinders is probably the wrong terminology, but I legitimately I tend to try to just like focus on what we need to do to support our customers and members, and turbulence zeroes out in the noise eventually. So.
Well, that's okay. That's great. So I actually, the other thing I want to hear a lot about actually, Sean, is what's going on now. So it's like this deal not really impacting your business, not really impacting the appetite for digital health for chronic condition care. One of the things that you guys just announced, which is really interesting to me, is via your partnership with Intermountain, you guys are now being integrated into their care delivery in a very different way. Yep. And this is another one of these like kind of seminal moments here that we're looking at where it's like, this is an interesting partnership. So tell me a little bit about this partnership with Intermountain. And my understanding it's with one of their subsidiaries, Castle, is that how you pronounce it? I'm
Yes,
sorry.
yep.
Okay, Castle. And what's happening, from my understanding, is that Omada's diabetes prevention program is now being offered at the point of care via like anybody who has their primary care physician within Intermountain Medical Group. But tell me a little bit more about this and how Omada is now being integrated into the actual physical care
Yeah.
delivery space.
Yep. Yeah. And we're blessed that it's our diabetes, program and capabilities as well. And it's a path I've wanted to take the business on for a really long time. I mean, you'll recall that I founded Omada Well Medical School. And I now have many practicing clinicians are like, when can I refer, into Omada? And, if you ask yourself, 5 years out, 10 years out, is a primary care clinician going to be the center of care for type 2 diabetes? The answer is going to be no. I mean, the world's not there yet. But there's just not enough professionals. There's not enough MDs, NPs. I mean, you name it. It's not going to happen without ancillary support. So we've always felt that the time would be right to do this. There's been kind of a confluence of macros that led it to be now for us, and it's a key part of the strategy. So we want to differentiate Omada as a business by getting as close to the medical home as possible and respecting the fact that, look, virtual care and digital cannot do everything. I mean, people need moles removed, biopsies need to be done. We focus on those care areas where we know a lot can be done from afar. And we know digital cannot just be incremental, but transformational relative to outcomes and value. And so we want to complement primary care and put out a statement. We don't want to compete. We want to be a tool in the infrastructure of primary care's toolkit and just bit by bit embed ourselves into the fabric of care. So I think the Intermountain is really our first example of what will be many to come, which is an explicit strategy that we think is differentiated for Omada. And we also think we're well suited to do it because Omada is always contracted as a provider. I mean, we're a covered entity. We file claims just like any other provider. I mean, we brought our trials to the AMA and they issued the first ever digital specific CPT code, to use as billing infrastructure. I mean, we're the only one in our space that's NCQA accredited. We were just welcomed to the Institute for Healthcare Improvement's Leadership Alliance as the first ever virtual provider. So it's we can approach these systems now as a peer and really establish kind of care partnerships in a way that we think is differentiated. So I'm spending a lot of time there and really fired up about it.
Do you feel like the health systems, like, I mean, and you're working obviously with Intermountain, and I know that you've got an interesting relationship with them. They're invested in you, I believe. Do you think the appetite for health systems beyond Intermountain is that of wanting to partner with a virtual chronic condition care company like your own as a peer? Like, I think that's an interesting way to put it, because I feel like up until this point, they've always been looked at as like a point solution, as a vendor. Do you think that the health systems, the provider group of potential clients is ready to look at you as a peer?
I think they are now. If you'd asked me that when we last connected, I'd say no. I mean, that was in part because COVID was very taxing on the systems and provider world. But even prior to that, there wasn't readiness. Either the provider system had taken on risk, but they had to put foundations in place and put together that program for late stage CHF patients that, if not addressed, would completely turn their economics underwater. Like, I don't think they were ready for chronic. And what happened over the course of last year is all of a sudden, many providers that we worked with for their employees started to say hi for their patients. And, and it was one did it, and then another did it, and another did it. And we're like, wait a second, we have like a lot of opportunities here. I think that's a signal, per the first comment, like, listen to the market as your first source of truth. And so we stacked up against it and put forward an explicit strategy and, announced Intermountain as kind of, again, the first of, what should be many here.
That to me is like really exciting, because we have not really seen anybody in your space go.
I've not seen it. Yeah.
So I think that's really interesting. And I have to ask you this, because like all the gossip around this, one of the questions that's kind of swirling out there, I want to get your take on is, what does this say then about like the employer market and the health plan market, which have been traditionally your customers? Because people are like, okay, well, wait, is Omada jumping into this health plan, or excuse me, health system provider market because things are kind of, there's waning interest on the employer and plan side? I mean, what's happening on the other side with the traditional market that you guys usually sell into?
Yeah, I mean that is and will continue to be our bread and butter for the foreseeable future. What sometimes people don't often realize is they intersect with each other in really meaningful ways. So I'll kind of give you an example right now. I mean, with
Yeah.
Intermountain, the employer customer conversations we're having in Utah are amplified because they're like, shoot, if I'm going to deploy Omada, why wouldn't I want to do it with a solution that's already integrated with the care areas where my employees are going already? So these intersections are very, very hard to address. And I think as a company commercializing enterprise healthcare, you need to think about all the stakeholders, but you need to be very methodical about kind of the order, the path, and the when, and the readiness. So, when entrepreneurs ask me for advice, you cannot go try to get all stakeholders in the same kind of, path here. You have to really think of what's unique about your business and what the right model is for you and for us. Finally, systems we feel are ready, and it solves this almost like, frankly, this like existential like anxiety I've felt about the business and what
Sean,
our
no, existential
no, I'm
anxiety. What?
serious. It's like about like what the end state is because I mean, if you look at what we've done, we're proud of it. But we've enrolled like 800,000 members and have over 1,800 customers, and that's great. And but we've done it kind of sidecar to the U.S. healthcare system. And I think and that's not just Omada. I mean, that's this whole digital health
Oh, yeah,
landscape of large economy.
absolutely.
So if you ask yourself, if that was the end state, did we make healthcare more fragmented? The answer would be yes. I mean, I couldn't look myself in the mirror and say that we created a more integrated healthcare world. So that's not acceptable. We just needed the systems market to be ready for us. I think over the next decade, we'll just get closer and closer and closer to primary care. And I think it's the moment to do it because if you look at labor shortages and trends in primary care against the epidemiological needs of the country, it's a harrowing picture. Like there is nothing but we don't have a choice but to find ways to amplify existing primary care infrastructure and support it because there's just not enough professionals that will be there, to handle the need.
As you resolve your existential crisis here and move closer to the health systems and to the providers, how do you think that impacts, and maybe if you don't feel comfortable speaking about Omada specifically, I mean, I'm curious about how you guys are handling this, but when it comes to the relationship with the patient, because
Yep.
to your point, yes, it became a little bit maybe more fragmented than it needed to be. And so how do you now, if you're in a peer relationship with a provider, who owns the relationship with the patient? How are you guys thinking about that?
Well, we think it's not us. We think it's the medical home or the primary care, organization. And that's just literally, it's a clinical, practical reality. I mean, again, not everything can be accomplished digitally. We've been very, very explicit in picking those care areas. We call them kind of between visit care areas. That we don't think operationally or financially the existing healthcare system is going to be able to, implement something like Omada. So, we come in with a humble approach, really describing, our goal of amplifying a primary care doc's capabilities of supporting a patient with type 2. Because when I speak with my friends who are PCPs, I mean, they have patients come in with diabetes and they're like trying to do their best, but they don't feel they're able to provide optimal care. They're praying that they'll see them in 6 months, and they're maybe nervous to change medicines because what if they put the patient into a hypo? They're telling them they should maybe think about diet and work to lose a little bit of weight if possible, but they don't think it's actually going to happen. So using Intermountain as an example, if I'm a PCP there, I can say, look, we work with a care partner for diabetes called Omada. I'm not going anywhere. They're going to keep me in the loop here, but they're going to support you on this really high touch day by day basis from between now and when the next time I see you is. So, let me know if I can help there, but like you're in great hands with this organization. And that I think is powerful because it leaves the clinician feeling like, they're not giving up on someone between those visits, and that feels good, and that's the right thing to do clinically. And then the patient actually gets the day-to-day support that's frankly required to get outcomes in these sort of care areas. So it's a win for everybody.
What's the physician onboarding piece of this look like for you? Because it's like I'm curious about that. I mean, and what keeps coming to mind for me as you're talking is like, wow, we're kind of seeing like the same pattern when it comes to all of the virtual or digital mental health solutions, where it's like, especially with the
Yeah,
poor primary care provider who's like, I wish I had someplace to send, my patient who needs this, and
yeah,
now they're finding those solutions. You're kind of filling that role here in terms of diabetes or maybe some of the heart disease things that you guys work on, or maybe even I don't know if the MSK offering is involved. It doesn't sound like it in this deal, but maybe ultimately. So,
sure.
how do you end up bringing the actual primary care physician, in that N of one along with you and helping them understand, what that experience is like as a peer to you?
Mhm.
What kind of data are they getting back? What kind of onboarding? Like, what kind of education are they getting? Like, tell me a little bit about that.
Well, there's generally skepticism, at first, which kind of makes sense. It's like, well, who is this organization? You're going to support my patients with diabetes. Like, what is it, an app? Like, what is it? So,
Yeah.
that's to be expected. And you have to, and that's again per kind of why I think Omada is right to do this. That's an area where we're quite strong. I mean, we come in, we talk about kind of the evidentiary base for our approach. We're NCQA accredited, and all of a sudden, like, oh, interesting. So are we. We show our clinical trials and our clinical data, we demo the product experience, and they can think, well, wow, that's really neat. Like, I could imagine maybe my patients liking that. And then you can't just rely on word of mouth and, training. You have to work with the systems to do things like patient portal outreach and, leverage their care management teams. Like Castell with Intermountain's a great example of that. I mean, their case managers are, in addition to the physicians, going to help support sharing that this is a benefit for their patients. So there's a journey there, but thus far we found that success breeds success. And I'll tell you a fun story. I can't name the organization, but many years ago we deployed with a big provider, but for their employees, which was kind of the more common way back then, before the patient interest surfaced. And the HR leader kind of called me up. He's like, Sean, you'll get a kick out of this. This is pretty funny. I deployed Omada. About a month or two later, I started getting heat from my providers, and they started calling me and be like, what have you done? Like, my patients are coming in, they're saying they're on this Omada thing. They're like, they've lost some weight. Like, why didn't you tell me that you were doing this? And the HR leader was like, he said, he was laughing with me. He was kind of joking. He was like, what are you talking about? I deploy all sorts of things on the benefit side without telling you. And he was like, yeah, but those don't work.
Oh, Sean.
So I mean, at the end of the day, it's the you can show all the data you want, you can implement, you've got the credentials, but it's going to be their patients coming back, showing success and saying that was really neat and valuable, like, thank you. And that it takes time, but that is the long game. I mean, bit by bit, that is how you start to earn trust with the clinical community.
Well, this is an exciting step forward in the long game. I want to ask you about something else that I feel like is really trending right now. And this is kind of speaking to that MSK side of your business
Mhm.
in particular, I guess. The integration of digital solutions now becoming like physical also. So we saw
Mhm.
Hinge announce that they're going to start doing house calls. So Hinge, big musculoskeletal care company. I mean, and you guys have Physera, which you acquired a number of years ago. I think back in that 2020, race for arms here, as part of your platform. Any designs to take Physera into an in-person model? I mean, I feel like you guys are really, far ahead in terms of how you're thinking about reaching patients, reaching providers in different ways. So, I mean, any thoughts there on this whole virtual care
Yeah,
becoming
yeah.
more in person piece of what's happening in the market right now?
Yeah, no, I mean, the always will remain open-minded, relative to it. I mean, right now there are no plans consummated to, bridge that gap, similar to there are other care areas. I mean, the Omada for MSK solution, formerly, Physera, is a really incredible product experience. I mean, you get a licensed PT, on video with you right away. They ideally, well, first they assess, like, can I accomplish care from afar? And in the 10% of instances where they're not, this is kind of that bridge. We're likely to lean on our system, partners there and be like, look, we can't accomplish what's needed here. What resources do you have? But in 90% of the time where they can, we'll likely take on the burden there. So, we do plan to still kind of like stay in the cloud, if you will, but really respect and cooperate and partner with the brick and mortar layer.
What about this idea of platforming out too? I have to ask this because it seemed like back then when that acquisition was made of Physera from you guys, it was like there were a number of other, chronic condition care companies that were out, like it seemed like acquiring anything that was kind of adjacent to the core diabetes business. So anything that was, related to cardiopulmonary or heart or mental health, or, it's definitely into this, physical therapy, back pain kind of space, those things. So like, what's your take on the platform? Because after that acquisition, you guys kind of stopped. And I mean, granted, we went through what we went through with the pandemic and all these other things, but does the idea of that one digital health platform to rule them all with all of the pieces, is that still it's something that you feel like the market is interested in, or do you feel like it's figuring out that integration point better?
I mean, we do. The way I describe it as selective breadth, which is it's a joke that is not even our decision on expansion. It's our customers telling us, "Hey, could Omada do this at such a persistent level that we really need to take it seriously and kind of listen there." And we're happy with the capabilities we have. I mean, prediabetes, diabetes, hypertension, MSK. These are the areas where we hear the most in the market. So there will be, I mean, 10 years out, Omada's of course going to be doing having other care capabilities, but relative to like this selling cycle, we feel like we've got the needs of our customer base. But again, always open-minded. I call it selective breadth because it is a heavy undertaking to expand. I think that one of the many challenges the early disease management industry had was finding a single client that asked and saying yes. It's like, oh, if you want congestive heart failure, sure, like we can do that. And then you literally go a mile wide, but you don't have like rich depth of care in every single clinical capability that's required to do the job properly, and we don't want that to be us. I do think we are seeing a trend that will continue of preferencing single partners if you can find the key areas within that partner. We've seen more RFPs in this selling cycle that were consolidation RFPs, where they've kind of done the point solution thing, and they're interested. Well, is there a partner that can solve all the key needs, and I don't have like 7 account managers, and I don't have my employees getting inconsistent care experiences relative to the comorbidity. So I think that is a trend. I think I think you can win in a point solution world. I think for us, our viewpoint is there's roughly 30,000 and change self-insured employers out there. We're proud we have about around 1,800 Omada. We think that mass market tips even more toward preferencing platform. There was always kind of a joke in the early VC community. It's like, look, these digital health companies that sell to employers have the exact same 70 logos. And it's not like the market completely taps out, but there is a subset of the employer market that really wants to just roll up sleeves and contract with solution after solution after solution after solution. So we think our strategy is the right one for the long haul.
All right, Sean, long haul Duffy. That's what I'm gonna start calling you now. Well, okay, because here's the thing I have to ask you about next, which is like you come out looking like a genius, Sean. IPO. I mean, like every time you're about to go public, like something stops you. I mean, I feel like the IPO conversation with you started back when Livongo IPO'd back in 2019. Then it became like the pandemic and everybody and their brother IPO'd. I mean, there were SPACs, there was this, there was that. I mean, it seemed like that was going to be the moment. No. Then you raised your Series E in February of last year, 22, and talking about going public at the end of 22. It doesn't happen until long haul Duffy. Tell me what's going on here. What's the strategy?
Well, I've been pretty consistent with the messaging here, and it is funny because it's like I would say during the pandemic, if anything, I got like criticism. Well, why aren't you taking the company out? And then now it's like, well, you're a genius. Good job on not taking the company out. And the funny thing, our time will come. I mean, when the strategy's there, it's an IPO is the starting line. It's a capital raising event. It's a different set of investors. It's like it's not. As an entrepreneur, I'm never like, oh my gosh, I can't wait on my resume to like take a company public. It's not. Yes, it's a big deal, but if anything, I try to minimize it, inside the organization, and and there's no rush. I mean, there are amazing private companies that have stayed private for a very, very long time before going public, and I think that at the end of the day, it is the right move for businesses to be public, and clearly that's not going to be 2023 for us, given the macros. So we've got the capital we need, and we'll just continue to run the business. And when the world opens back up, if we feel it's strategic, we'll either take the company out so we can finally satisfy all the questions, or we'll just hang tight, and you'll 5 years from now continue to be asking me when is it going to happen, Sean.
Well, no, I mean, it's awesome though, because it's like really, it's like you look back at that and it's like it had to be hard not to go, and then to now be on the other side of it and be like, okay, I mean, it says a lot about, I think, the long-term strategy, the Sean Long Haul Duffy. I love
There
it.
we go.
All right, hit me up with just something good to close this out, Sean. Like, I mean, tell me what's ahead. I mean, like, you guys are sitting on top of
Yeah.
like a real opportunity here in this provider space that I think is really compelling, and I love the way that you explained it. So there's that. I mean, numbers are good, growth is good. You guys are sticking in there. You just said you're well funded. So I mean, like, what's ahead then for 2023 that you're really excited about? And just end with with what we can kind of expect from Omada moving forward.
I mean, maybe it's just a double click on what I've shared. I mean, there's all sorts of just amazing product and tech capabilities that are happening behind the scenes at Omada to continue to, deliver for our members, and our customers. But when I find myself thinking about where we're at as a business, the chance to get close to primary care is one of the things where I'm spending, the most amount of time. Even though it'll take time for that to become a hugely meaningful piece of our business. But it just touches my heart in a way that feels exciting, because when I was in medical school, I was imagining that maybe digital health could complement a clinician, and then I watch my friends practicing and they don't have the tools that they need, and I just am really fired up about it. And I think that and honestly, it hasn't happened before, so it's like, I think we have a track record of a lot of medical firsts at Armada, and I want to continue that, and I want us to be the first to like just siphon digital health right to the point of care in ways that like actually works and is not like smoke and mirrors, and we have evidence around it, and like actual clinical partnership and referrals and credibility. So and I think we're going to pull it off. So it's and I mean, we couldn't be more blessed with a first partner. The Intermountain's an extraordinarily well regarded organization. We're very humbled that as kind of our first crack at really patient deployments for our capabilities, they're there as tip of the spear. So I think that's just getting going, and we're fired up about it.
Awesome. Well, you're firing me up now, Sean. I love it. I mean, I think I was fired up before. I'm even more fired up now. Well, seriously, and keep up the great work. I mean, you and your team at Omada have really, I mean, it's been a remarkable story. And I feel like it's like I've covered you guys for so many years now, and it's like it's still growing in newer, more different, deeper ways, deeper connections with the healthcare system. And it's like, this is how, change happens, right? So it's exciting to me too.
Awesome. Well, thank you. Thank you so much. Jessica. Always great to connect.
We are not waiting 2 more years till we talk
Yeah,
again.
exactly.
So,
Let's pre-calendar. Exactly.
It's way too long. All right, but I feel caught up now, Sean. So thank you so much for dropping by.
My pleasure.
All right. Well, everybody, that's Sean Duffy, the co-founder and CEO of Omada Health, talking to us about all things chronic condition care, virtual care in that regard, and integrating with the health systems now. Exciting news there. For more interviews with the who's who of health tech as they are changing the way that we do healthcare, you can head on over to my YouTube channel. It's youtube.com/WTF Health. I'm Jessica DeMassa. Thank you so much for joining us. Sean, thanks again. It's a pleasure to see you. We'll talk to you soon.
Pleasure.
Bye, everybody. Thanks.